Well, hello, everybody. Welcome to the Spine Rehab Specialists podcast series. This is episode number 10. And today we're going to talk a little bit about workers' compensation and some other things surrounding it, but at least that's going to be the premise of today. So I have with me, Dr. Jose Gutierrez. Joey, welcome.
Hello, everyone.
So let's talk a little bit about workers' comp, because it's really kind of like its own little thing in general. So workers' comp is essentially an insurance that an employer buys to cover the employees. So that way, if they get injured at work, the medical expenses are covered, but also the loss of work is covered. So it's a little different than what we usually deal with our private insurances or Medicare or anything like that, where that's only the healthcare benefits. But with workers' comp, there's also the income benefit. So it does work a little bit different. That's kind of what we want to talk about today. So. Joe, you want to talk a little bit about some of these workers' comp injuries? What is like a typical injury that we may see in the clinic?
Typical injury, there's really none here. It varies from back to neck to shoulder to knee. I've seen it all. So I'm a functional capacity evaluator. Have been for I think going on four years now, and I see a lot of injuries.
Yeah, it really can be anything. And if you look at, I'll mention a couple of the interesting injuries that I've seen. I had a lady who got injured, during 9/11. She was actually there in New York for a course, and obviously had to get, quickly out of the buildings. And she sprained her ankle, and so she had the ankle sprain, but also the trauma from being part of of 9/11. I also had a lady one time that claimed that she slipped on a fly on the floor. That was, sure an interesting one. But yeah, we see a lot of, lifting injuries or slip and falls. And a lot of times it's, it's just kind of doing things just a little bit the wrong way, maybe a little bit too rushed or anything like that. So, okay, so how do we treat those, in the clinic? Obviously, there's just a little bit of a different twist on, because it's workers' comp, right? You want to talk a little bit about that?
Yes, definitely. So it is different in a sense that we're trying to get the patient back to work, but oftentimes there's a strong fear component, Harry, that I'm seeing, which is oftentimes like their biggest barrier to returning to work. Not only the physical portion, but also the mental portion is something that we really need to work on.
It is a little bit different, because I think a lot of times people are afraid to go back to doing the same thing that got them injured to begin with. And even though that may not even be reality, because sometimes it's just one of those things that something bad happened one time that's probably not going to happen again. But at the same time, they may go back into that same situation. So, and there is that pressure of wanting to go back to work as quickly as possible. And of course, that's on our end as physical therapists. We always want to try to get our patients better as quickly as possible. But now there's also the employer that obviously needs the employee back, the insurance company that wants the employee back as soon as possible. So it kind of creates a lot of stress and a lot of friction on employees.
Yeah, so it's not a typical 2-week treatment. So there is a lot that we have to cover. From the strength deficits that they've experienced since the injury to like I said, the fear component, trying to get their mind and body just back into it and wanting to go back to work. So yes, the treatment is a little different on that note. So we pretty much have to expose them gradually to strengthening and also a fearful activity that they may be avoiding or having uncertainty whether they should be doing. So yeah, it is a little different than your typical, shoulder, neck, back pain.
Yeah, definitely. And there's even some programs that are designed specifically to help to try to get somebody back to work, right? So there's work conditioning, work hardening that really is only for workers' comp injuries. That we don't do that on an Aetna patient or a Blue Cross patient or something like that. So, want to talk a little bit about those two programs?
Yes. So going from workers' compensation injuries and getting physical therapy. So once you're done with, or once the patient is done with their physical therapy, they're at a point where can the patient go back to work, or simply where are they now? as far as physically, mentally. So as I was mentioning before, I'm a functional capacity evaluator, aka FCE. So after the physical therapy sessions, typically the physician would order an FCE. That's an extensive test, about 3 or 4 hours, depending on what we need to look at. That'll help us determine where the patient is at physically from head to toe, not just the injury that they sustained.
Yeah, and even part of the FCEs, there's a little bit of testing too to see where they are, psychologically. Are they ready, or is that fear, is that really getting in the way, or does the patient exhibit certain kind of abnormal pain behaviors that we're seeing? Right. So that's all kind of built into that FCE, and that's why it's such a long test. And one of the things we're looking at too is the patient really trying or not?
Correct.
Right, because it's workers' comp kind of has this bad reputation of there's people that are just they're faking it and they take advantage of the system. And even though we definitely see that does happen sometimes, I think a lot of times it's really more an issue of I want to go back to work, but there's this fear, there's this pressure, and I think that really starts kind of really messing with somebody as far as can they go back to work or not. So the FCE really is designed to test them physically. Yes, can you are you able to lift a 20-pound box or a 40-pound box or whatever you need to lift, but also do you exhibit the right behaviors that will allow you to go back to this job, right? So, and that's why it's such an extensive test. It's actually, I think it's an awesome test. I'm a functional capacity evaluator as well, semi-retired from that. That's why Joey's doing them. And I've done a lot of those. I've done them for 20 years and I've done hundreds and hundreds of them. And they're actually very interesting tests, really give you a lot of answers that now the doctor, the insurance company, the employer can use to see, can we go back to work? If we can't go back to work yet, what do we need to do to get there, right?
Yes.
So in your FCE, you really come up with a plan in, ideal scenario, patient go back to work without restrictions, normal, regular duty, great, perfect. But if they can't, then you can help determine, will a work conditioning or a work hardening program help the patient go back to work, or are they just not going to be able to go back to the regular job, and do we need to look at either modifications or a different job? So how do you determine in your FCE whether somebody's a candidate more for work conditioning or work hardening? In other words, what's the difference, right?
Right. So the main difference between work conditioning and work hardening is basically, as you were talking about earlier, that psychological component, that psychosocial component, that fear, that uncertainty. That's typically when work hardening would be deemed necessary. And that would not only, so I'll differentiate, I'll go back and rewind a little bit. Work conditioning would be simply just trying to get the patient back to work physically, trying to get them back to lifting, carrying, pushing, and pulling what they need to do. 2 weeks typically, and they're ready to go. Work hardening, I'll go back to that, is a little different in the sense that the patient will need to see a counselor to kind of get them through this wall that they're experiencing that they can't jump over, go under, or just drive through, and that's pretty much the difference.
Yeah, that's definitely the difference. Your work conditioning, pretty much you just need to get stronger and better at what you're doing. There's nothing else in the way. And work hardening, there's just something in the way. And we want to help people get back, get back to work and get over that. But that's why we get a counselor in to help to get over that. That's probably just a little bit beyond what we're capable of doing it. And patients seem to really respond well to that. I mean, it's getting over that fear, getting over that how pain is affecting them. So I really like both of those programs. And years and years ago, I've been in the field a little longer than you, Joey. Mm-hmm. The programs actually were always like 6 weeks, 8 weeks. But what would happen, you do an 8-week program and somebody's still not able to go back to work, then there was just a lot of time and money spent on that. And I think that's why they've cut it down to, usually we get 2 weeks, and with a little bit of luck we can probably extend it for another 2 weeks, but a lot of times that's all we're getting. But these programs are really, really good, and we try to, as much as possible, include work simulation. And it really kind of goes with our creativity as a therapist, because obviously we may not have the exact job situation, but at the same time we can mimic it as much as we can. You have some examples of that, Joey?
Yes, actually, one that I'll never forget. I had an FCE on a law enforcement officer who was required to defend himself and take down and pretty much defend himself and his comrades. So I pulled one of our technicians. I told him, beware, be ready, because we're gonna try to run from this guy, and we did, and he took us down pretty well, which you're ready to go back to work, definitely.
Did he handcuff you and put you in the back of his car? Or not?
No, we didn't get to that point.
Okay.
I said, okay, I believe you, you're good. So, also, if the patient is required to climb a 12-foot wall, we got a wall in the back that, if they feel safe to do, all right, let's do it. Just anything to try to mimic their work situation. Not only does it make it fun for them, but it makes it fun for myself as well. So
yeah, I think that really makes it fun and exciting, and like I said, it really goes on our creativity. Probably my best example was a cook in a really good restaurant. So guess what? She had to make us lunch.
Hey,
it worked out really well. So, but you really were just trying to find the things that mimic their work as much as possible, and that's really what these programs are for. Because it's great that you do an hour of physical therapy and we stretch and we do strengthening, but first of all, it's an hour. That's typically what physical therapy is. Mm-hmm. How do you go back to doing something now for 8 hours, right? Because nobody's work is 1 hour. We have to do activities for 8 hours, and things kind of build up. I mean, you get tired at the end of the day, especially this is typically done for physical work. Some people get get definitely tired by the end of the day.
Yes.
Good. So, looking at these injuries, is there stuff that can be done to help prevent injuries? Because wouldn't that be better?
Absolutely.
So what do we do for that? As far as is there testing that can be done to see if somebody is ready to do a certain job or not? So not necessarily the FCE after the injury, but is there testing that we do in the clinic, before maybe somebody even starts a job already?
Yeah, so we actually do post-offer pre-employment testing as well for several companies who require their employees meet a certain physical demand level, and that's after going through a physical with a physician, which is typically a DOT physical, hair follicle exam, all that stuff, and then their last piece of the application would be here to make sure that they're physically able to do their job. So that's after a quick musculoskeletal screen, check the neck, the back, their strength, their flexibility. Once I deem that it's safe to continue, then we'll have them, lifting whatever they need to lift, and they're ready to start their job.
Yeah, these tests, they're actually not quite as simple, as what it seems like on our end, because you have to determine ahead of time what is really crucial to do your job, right? You can't just put them through a whole battery of tests that have nothing to do with it. I mean, I can't have a physical therapist, you have to lift a 100-pound box, and if not, you can't work here. It's like, well, but we don't lift 100-pound boxes as physical therapists, right? So it would have to be something applicable for this employee. But it's really good for us to see that. It's like, you need to be able to physically do the job, because if you're not able to do the job, then you are going to get hurt. Yes. Like even under the most perfect circumstances, if you just can't physically do it, if you need to lift 30 pounds but you can only lift 20, but you're going to take the job anyway because you need the money, people are going to get hurt. So that's definitely very helpful to try to prevent these injuries from happening by only accepting the right candidates.
Yes.
And it helps companies, because they're not going to look at somebody and say, well, you're short, overweight, skinny, underweight, female, old, whatever. There's either you can do the job or you can't do the job. So it really takes away even the discrimination part of it.
Yes. Yeah, and on that note, it's not just a musculoskeletal component. It's even a cardiovascular component. Like if their blood pressure, for example, or their resting heart rate is not within safe levels, then there's no way we can test them, and we'll refer them out to get medical clearance. They'll come in again and do the test. If they're cardiovascular system is ready for it as well. So it's not just musculoskeletal, but I'm also testing that cardiovascular component as well. So
some of these jobs are pretty heavy out there, aren't they?
yes, but I think if your company makes you do these tests, then they really care for you and they care for your health.
Yeah.
Because these aren't cheap tests.
Nope, they're not. And really, ultimately, an employer does not want their employees to get hurt, right? I mean, sometimes employees think that, the employers don't care. No, they do care, but at the same time, a job needs to be done,
Right.
So, yeah, we've even done some, some general education, for, back safety and things like that, just to even help prevent, injuries.
Yes.
So what has been, probably your, most intriguing workers' comp case that you've seen, Joey?
Harry, that's a good question. They all kind of hit me in a special way because they're just so different. What gets me the most is when I hear that they've done physical therapy after their injury elsewhere and they never got better because they were doing the same thing, no hands-on. I think those are the cases that really bug me the most, because it kind of puts a sour taste in my mouth and also gives us a bad name when you're doing the same thing over and over and over, and sometimes you don't even know who your physical therapist is after an injury. If I were to get injured and I go get treatment, I would for sure want to see the clinician and not a technician. But that's just my opinion. So I think those are the ones that get me the most, is when I hear that and I see how far behind they are when they could have progressed a lot quicker had they had the right type of treatment.
Yeah, you're right. Because I think a lot of times, injuries happen. It's tough, it's bad, but they happen. How do you respond to it? And I think that's any time, like, how do you respond to a situation, right? Things happen in life, but how do you respond to it? But if the medical field is really, shortchanging the patient, and that's hard to see. And we see those examples, unfortunately, quite a bit. We work hard to try to catch up with whatever didn't happen before, but I always think it's so interesting to see some of these injuries. I had a fisherman that hurt his shoulder, 3 days off the coast of Alaska. So he had to suffer on that boat, for 3 days, because guess what? They were not going to medevac him out. They just had to wait until they were back in the, in the port, and then they can get off, off the ship and, come back to El Paso. And that was an interesting one, big surgeries. And then some of our, workers' comp, and people probably don't realize these are workers' comp. We've had some NFL players in here.
Yeah.
Guess what? That's workers' comp. They get injured at work.
That's their job.
So yes, probably our most notable ones have been, getting paid by NFL teams. Kind of fun when you see a Pittsburgh Steelers, check coming in, or Miami Dolphins check or so. It's kind of fun.
Yes.
It's not quite as, the UPS checks, it's the same amount of money, but it's just not as much fun when it has a, the Steelers logo.
Team logo.
Unfortunately for Joey, we have not had a Cowboy player in here yet, but that's, that may be in the works sometime, so.
Hopefully.
All right, good. Anything else you have to add, Joey?
No, very no.
Good. So we just want to talk a little bit about, that whole workers' comp, system, because it is, I think it's so interesting, and I think it has such a bad rap. And I don't think that's justified. I think we just need to work with the patients, do a good job with them. Yes, there's one or two bad apples in there, but I think in general, these are people that just need our help and they need our attention, and we need to get them back to work.
Yes.
So awesome, great. Well, I hope this was interesting for our audience. Thank you guys for listening to this podcast, and looking forward to the next one.
All right, thank you guys.